meeting. I am not Commissioner Mary Cooney. My name is Justin. I am the Director of Spokane County's Community Services. Unfortunately, Commissioner Mary Cooney will not be joining us. Her duties as chair of the board has taken her other places today. So I do apologize. You're going to have to be okay with me. I know I can't ever replace and or take over the wonderful and amazing abilities that she possesses, but I will attempt to do so this morning. For those that are joining us, as always, please put your name and your title in the chat. We're going to keep track of everyone through that avenue. So again, your name and your organization and title in the chat. We'll keep track of individuals' attendance in the chat feature. For those that are not speaking, please ensure that you're muted. These are just all common requirements as we look towards this teleworking environment. And also for those that are up to speak, you can start your section by introducing yourself and your title and background and then jump into it. So we'll do that way for introductions when and if you are going to be speaking to a specific topic for the agenda. So before we begin, if there's any questions, start, please put those in the chat or to announce them directly. Raise their hand and or speak now. If none, then we're just going to jump right in because it's Friday, the 13th, and I'm sure people have a lot of other things they want to do, so we want to make sure we stay within our time frame. We're going to start first with updates from the governor's office. So I'm going to turn it over to the multi-system care coordination update. Do we have?
Good morning.
Good morning.
Can you hear me okay?
I can, yes. You are first up. If you want to introduce yourself, that would be terrific.
Yeah, thank you so much. And I don't know, my understanding is Amber leaders comes here providing the updates largely from governor's office at this meeting. My understanding today is that myself and Jennifer Chancellor, who are more program specific to particular projects, will be able to provide specific updates on the works that we are carrying out. Is that in alignment with what you were thinking?
Yes. So the interlocal leadership structure provides information and direction for our 6-county region in support with our state and local partners on behavioral health and healthcare related activities. So having the governor's office present and sharing a little bit about what they're doing, Amber volunteered both of you to share a little bit about both 988 and the children's multi-system care, because those are issues that are impacting us currently. So yes, just speaking to that as it pertains to our 6-county region would be terrific.
That's great. Thank you so much for that clarification. My name is Taku Minashita, and I use he, him pronouns, and I'm serving as project director of Children and Youth Multi-System of Care in Washington State, where we have been working on implementation of a bill, second substitute House Bill 1580. If it's okay, I'll try to share screen so that there's something other than myself, my face, or the agenda we can look at. Let me see if I remember how to use Zoom still. Can you see the screen okay?
Yes.
Okay, and I'll be conscious about the time that we have here as well. Again, thank you for making the time to hear kind of an update, and I don't know how much of the context that this group has about the 1580 Children and Youth Multi-System of Care. I thought I'd start with a little bit of the history and the context of the Second Substitute House Bill 1580. Let's start by acknowledging the historical challenges the children youth system of care as a whole, around behavioral health, around education, around IDD, has been struggling to serve particularly of those children and youth who have complex needs involved with multi-agencies. The coordination and work collaboration alignment has not been easy, despite many of the attempts to implement the core value and a principle around wraparound. It has been a challenge. You all and the stakeholders and the Washingtonians have made it clear that through the legislature and the passage of the 1580 in 2023 session that the Washington needs avenue to go to try to resolve this in the way that is human-centered, integrated system of care that makes decisions for the best interest of children, youth, and families, not of the entities individually or agency or the department, their best interest. Rather, that the decisions are made for children, youth, and families who are struggling. Also, in the acknowledgement of that, the historical tendency that Washington State and many other states had about expecting children, youth, and families to navigate extremely complex system that we create and we run. But that has impacted the service delivery and access to service on the children, youth, and families. The notion here that has been discussed through wraparound principle is that it isn't the children, youth, and family that needs to be expected to change their approach to utilizing and maximizing the services and resources they receive. But it is time for the systems to make an adjustment so that children, youth, and family gets the services and the needs met in timely fashion. We have approached it in this way that the Office of the Governor holds a lead coordinator position. That is my current position. I started on May 16th. We work with a representative from each of the agencies, namely DCYF, Department of Children, Youth, and Families, Developmental Disability Administration from DSHS, Healthcare Authority, and myself. We also have a project and program dollars that we were able to tap into to obtain project management support and a consultation from Max Brown from Office of Financial Management. And we are getting program review, program data and research analysis support from DSHS RDA, Research and Data Analysis Division. In the bill, we have been directed to serve those particular three populations who are at risk of remaining in a hospital without medical necessity, without ability to return to the care of the parent, and not dependent under 1334 CW. Those children and youth who are staying in hospital without medical necessity and unable to return to the care of the parents and the caregivers. And lastly, those who are dependent under 1334 RCW and experiencing placement instability and referred to the rapid care team by the DCYF. We have just a little bit of additional context on the process. The bill passed, as you know, in 2023 session, and it was in effect in July. Funding and the program funding was in effect starting of July of 2023. The bill stipulated that the rapid care team to be established no later than January of 2024. The governor's office was a little bit slow on getting this program launched and moving forward. As I indicated, I was appointed into this position in May 16th of this year. While the demand was there, the hospitals and the community who have already struggled with those children who are remaining in the hospital without medical necessity struggle. 3 major hospitals in Washington state who works with children and youth, Seattle Children's Hospital, Mary Bridges Tacoma Hospital, as well as your Spokane Sacred Heart Hospital, has been anticipating this to be in place for a long time. And by January of 2024, without there has been established framework developed, start to inquire about those issues be resolved, and reached out to governor's office as well as healthcare authority and DDA. In response to that, the governor's office reached out to healthcare authority asking support, as they have some experience in holding care conferences and multidisciplinary team meetings already. Healthcare authority took leadership and brought DCYF DDA together and OFM together to start to create an ad hoc let's fly the airplane version of the rapid care team. Since I was appointed into the position in May, we have committed to keep flying that airplane in the air, and on the background, we will rebuild that airplane while it's flying, and to be closer to the value that we uphold. I believe that we are getting closer to create the rapid care team care conferencing and how the system work with each others in more streamlined way. Long way of saying, we have started the ad hoc process. We have finally going through many of the stakeholder conversations, speaking with the providers and systems partners, as well as listening to and speaking with those people who are closest to the ground, the workers, the social workers, and those people who are impacted by the work. So those people who have lived experience in navigating a complex system to access service, programs, and resources. I am here to invite you all, and I'll probably put this in the chat, to a town hall that we are hosting on September 18th to talk about the new and more formal 1580 system flow, as well as standardized rapid care team case conferencing model. So I'll put that in the chat in a minute. There are some documents that you can access that I will also put those in the chat. And I will also put my contact information for additional questions and feedback around implementation of 1580. I will pause there. And I think I'm going to leave with this slide. I don't know if you can tell it already or not, but I'm pretty excited that we are finally here, that we have the model established, that we can, none of these models will be perfect. I want to say that, and we will continue to manage the quality, and we will hold some kind of a check-in probably before the holidays to see how that new process, new protocol will be received and how will be functioning. But on next Wednesday, September 18th, we will hold a town hall for anybody who are interested in to learn about what kind of model did we come to, and how do we envision the system flows across many agencies and children youth system of care as a whole. So thank you for that, the time and attention, and I'll just pass it back to you in the big room there.
Do we have any questions or comments for presentation or for Taku? Seeing none and seeing no hands raised, I appreciate the update, and I know that we're doing a lot of work from the ASO side with our REACH team, which is the kids' mental health and the efforts going on there at the governor's office. So we look forward to more information and partnership as we move forward. Excellent. Moving on to our next agenda topic, I believe, Jen, this is yours now. Turning it over to you.
Yep. Good morning. And thanks for the opportunity to come speak with you today. I am Jennifer Chancellor, and I am also new to this position, a little bit newer than Taku. I have been here less than 60 days, although it feels like less than 60 seconds some days, that's for sure. Some of you I know recognize me because I have transferred over to the governor's office from the Healthcare Authority. So I am the newly appointed statewide 988 systems coordinator with the Office of the Governor. And I have taken over for my predecessor, Megan Celadonia, who transitioned out of this role at the end of, I believe, 2023. So it's been a while since she has transitioned out of this role. And I do not have a fancy PowerPoint for you today, so you're just stuck looking at me as I give you some high-level milestones for our 988 program. And just so you know a little bit about, for those of you who don't know a little bit about my history with Healthcare Authority, I did for the previous 5 years work under Ruth Leonard, who I actually see in this meeting, and Jessica Diaz in the strategic design and program oversight. And I also was actually tasked with the Youth Behavioral Health Navigator program, which ties into the 1580 program that Taku was just talking about. Prior to coming up and working with the Healthcare Authority, I have, it's kind of scary to say this, but I have almost 2 decades in working with Medicaid program design and implementation. So sometimes it's hard to say that for 20 years I've been working with these type of things. So I'm really excited to be part of the 988 project implementation. And this is just really exciting times for the progressive work that Washington State is doing. So I have just brought to you just some high-level milestones that we have recently reached in the 988 implementation program. But first, for those of you who aren't familiar with the role of the statewide 988 systems coordinator, I did want to just kind of give a high level of my responsibilities as the systems coordinator with the Office of the Governor. So for the duties in my role, I oversee the statewide implementation of the 988 program with our behavioral health partners. I also collaborate with our lead agencies who are accountable for the work. And I also assist with escalation of issues with our agency decision makers. I do work closely with our Crisis Response Improvement Strategy Committee and also the other related committees who are helping inform the work of the 988 implementation project. I'm also tasked with communicating on statewide implementation. So it's perfect that you invited me here to give some updates about where we're at with this work. And I'm also an appointed member of the statewide 911 advisory committee as part of this role. So I wanted to just give a couple categories of updates of some important milestones that are happening right now. And the first category I'm going to talk about is some technology milestones that are really exciting for this program. And then I'm going to share some milestones that are a little bit more person related. So some technology milestones that are currently happening that are very excited is that DOH and HCA just kicked off the 988 technology platform feasibility study. So this kickoff actually, and this is with an outside vendor. This kickoff just happened yesterday, actually. So it's pretty exciting to get this going. And the feasibility study is going to help inform the state, and I'm just referencing some notes here, is going to help inform the state in making a strategic directional decision between the technology platform that we're going to use for 988. And some of the choices that they're looking at are, do we develop a purpose-built system of systems to meet Washington State's unique requirements? Do we implement a new comprehensive behavioral health crisis response system that uses our existing emergency network infrastructure that already exists within Washington State? Or do we choose to continue working with the current national provider, the 988 provider, who is called Vibrant, and implement the functions as they become available based upon Vibrant's schedule? So those are some of the things that we're looking at. And so this feasibility study launched yesterday, and the outside company who is supposed to look at this in a non-biased way is supposed to wrap up this feasibility study with recommendations to the state at the end of 2024. So we are very excited to get this information at the end of 2024 to see what this feasibility study comes up with. Another pretty big technology milestone that we have reached recently is related to geo-routing. So I don't know if everyone knows what geo-routing is, so I did want to just give a quick kind of a vocabulary or explanation of geo-routing, which is different than geolocation. So geolocating is something that is used for 911 calls where you can pinpoint somebody's location, but geo-routing does not pinpoint somebody's location. So geo-routing is a way of directing phone calls locally that does not include the caller's precise location information when they transfer the call data. So when a person calls 988, and this is currently happening in Washington State as of, I think, about 2 weeks ago, their call will be sent automatically to a crisis call center that is near their physical location. And so with geo-routing, the routing and service providers, again, do not receive detailed information about the exact pinpoint of the callers. And geo-routing currently has gone live for Verizon and T-Mobile cellular callers. In the future, they're also going to roll it out for AT&T mobile callers, but currently it does not affect voice over internet protocol calls. It does not affect wireless calling. Like when I come into my house, my cell phone will hook onto my Wi-Fi and it'll be wireless calling. And it also does not apply currently to chat options or to text options. And so this is a very important step in the technology related to the 988 implementation. And this is going to assist callers in connecting to regionally specific centers who are the most well-versed in their community-specific services and local resources. So for myself, since I have, and a lot of us who move around don't change our cell phone numbers when we move around. So if I were to call 988 from my cell phone, because I have wireless, I have a 541-890. That's the beginning of my cell phone number. That would route me to something in Southern Oregon, even if I am physically in Washington State. So with geo-routing, now that would actually link me to something in Western Washington. And so that's why this is important. This is also going to help our partners SAMHSA and Vibrant to be able to better forecast call volumes more accurately at each of our 988 crisis contact centers. And the next thing I wanted to talk about is that we are currently working on implementing text and chat options for our Native and Strong Lifeline for Washington State. However, this is still in the implementation stages, and we don't expect the text and chat options to go live until early to mid 2025, I believe it says. So next I want to talk about some other milestones that are a little bit more person-centered that are currently happening. So we are currently in the process of winding down or sunsetting our subcommittees that have been informing the Crisis Response Improvement Strategy Committee. This is also referred to as the CRIS Committee. And for those who might not know what the CRIS Committee is, the CRIS Committee was established for the purpose of providing advice in developing and implementing our integrated behavioral health crisis response system. So our partners at Healthcare Management Associates, they are the contractor who've been doing much of this work for a while now, and they are getting ready to prepare a comprehensive environmental scan and assessment of their work that they have been doing, I believe, for the last 2 years. And we expect to have this report out from them at the end of 2024. In addition to their report out, they're also going to be creating a transition plan that talks about what happens with our CRIS committee next as it transitions under the Healthcare Authority is going to be resuming the facilitation of the CRIS committee sometime in 2025. So they'll be talking about that as well. And the other thing that I wanted to briefly mention, which I'm sure that everybody at the BHASO is well aware of this, but last week, Healthcare Authority and Department of Health had released a joint statement about the future alignment of the regional crisis lines and the 988 contact hubs. And so there was a few-page document that went out that talks about the future state. It does cover the key considerations and the findings from the work groups that were comprised of internal and external stakeholders, and what the vision of the future alignment looks like, and also how we are going to transition to the future state alignment. And I did want to acknowledge that although there are still a lot of implementation details that need to be resolved, DOH and HCA are strongly committed to ensuring a smooth transition, and also will be engaging with each of the BHASOs, the regional crisis lines, and the 988 lifelines to develop transition plans that are specific and meet the specific needs of each region. And although there is a lot of other work going on in the 988, I feel like those are kind of our more recent impactful milestones that I wanted to share with you today. I can go ahead and drop my contact information into the chat. And if people have additional questions and such, I am happy to take those back to our team of experts that we have at Healthcare Authority and Department of Health and provide follow-up information if necessary. And I would like to say that that's all I have today, but that seems like I just talked a lot. It's like a lot of information.
No, it is, but at the same time, I think we've been talking about this for a while, so it's a good catch up to know who's now taking point there and lead at the governor's office in terms of coordinating that. It's good to see you in this new role. So congratulations, because we've worked with you quite extensively at HCA. So seeing you over there at the governor's office, just want to say congratulations.
Thank you.
Any comments, thoughts, feelings, concerns, expressions of joy, or questions any member may have? All right.
And my assumption would be that maybe people need a little bit of time to think about some of their questions. This is a lot of information that heavily impacts the regional crisis lines, the BHASOs, and the way that we are planning our crisis response in Washington State. I do know that you have very informed partners that you work with Ruth Leonard and with Jessica Diaz. And so I am assuming that they keep you very informed on these things, but we're always open to any questions that you might have. And we're always open to coming back and giving more updates as requested for any of our regions. And again, thank you for the opportunity.
Yes, I'm sure we will take you up on that in the future. We will be giving an update today briefly on the regional efforts that we have in place, really working with our partners to keep information out there. And so I should be providing that. But I'm not seeing any comments or raised hands, so we very much appreciate your time. And for sharing from the governor's office on both the youth multi-system of care updates as well as the 90-day.
Thank you so much.
Thank you.
All right. We like to provide our state partners with the opportunity to share. We don't have anything specifically listed for the Healthcare Authority or Department of Health, but we wanted to make sure that that opportunity is there in case Ruth or Jessica, you wanted to share any updates or anything you feel pertinent to this regional group.
This Ruth, I don't
Hello,
have any updates.
Thanks, George. I collected a few for you all today. Just excuse me, a couple to give you updates on. The first one is that the Healthcare Authority did submit earlier this week our grant application. It's a planning grant application for our CCBHC work. So that went in, fingers crossed we can get that planning grant. CCBHC being nope, now I'm gonna mess it up. It is kind of like our FQ for behavioral health. Somebody help me out on why I can't remember what both C's are. Nope, maybe another
Behavioral Health Center.
Thank you. That means I definitely need more coffee this Friday morning. The other thing that I was just going to give an update on is we have been working with a large group to develop some measures as a result of some legislation last year. 1515 was that bill number. We have come to some consensus within that work group on what behavioral health network standards will be in place for 2025. We'll also be sharing that next week as well in a Washington Association of Counties presentation. So those were the only two updates that we had collected that at this point in time. Happy to take other questions as well.
Jessica, do you know what meeting that I'll be presented at for WASAC?
A legislative committee meeting on the 19th. I'm looking at my calendar right now. Sorry, let me see if I have the exact. WASIC's Legislative Steering Committee on, yes, the 19th. The afternoon.
Excellent. Appreciate that. I know a lot of our counties are participating in that, so I want to make sure that they're aware. They have there's a lot of feedback I feel WASAC would like to provide. Any other questions for our HCA partners? Hearing none and seeing none in the chat. We appreciate, Jessica, your time as well as you, Ruth, being on a Friday. Thankfully, it's the morning and not 4 o'clock on a Friday. So thank you so much for joining us and sharing the information. I know we'll have more as we look towards the meeting in December, but just appreciate your time here today. Excellent. So before we jump into the third topic agenda, I want to open this up to our members. If there's any topic they would like to cover before we jump into updates, we leave the fourth one open for any other comments from the stakeholders that are not members, but for the members of the SCRILS committee, any topics that you may want to cover now, any elected officials or any directors of agencies that did not get back to us. All right, last call for any last updates before we go into our regional and quarterly updates. Excellent. So this is an ongoing topic of update for our regional behavioral health administrative service organization that does serve the 6-county region. We like to give updates not only to what we've been up to as we look towards the future changes, impact, behavioral health legislation and funding and services, but also what are we looking at as those services are being implemented? What is the updates to crisis response, as well as coordination with our regional partners? So I'm going to turn this over to Ashley McGee, our Regional Behavioral Health Administrative Service Organization Manager, who will give an update on some of the work that we've been doing, some from a county perspective, some from the Opiate Abatement Council perspective. These are high-level updates. So if you have any questions, please let us know. And then we'll also touch on some other projects that we've been working with closely with our state partners as we look towards the future in our region. So without further ado, Ashley.
Thank you, Justin, and good afternoon or good morning, everyone. Nice to see you all, Ashley McGee. The first thing I wanted to talk about today was an update regarding opioid settlement funds. Justin's previously spoken on some of the key priority areas that were identified by Spokane County's Board of County Commissioners on investments for that funding that came through. And there was 4 different areas of investment. I'm happy to report that earlier this week, we were able to execute contract for long-term housing support for parents and caregivers of infants affected by neonatal abstinence syndrome with a community partner, Maddie's Place, here in Spokane County. So we're really looking forward to see what they can do with those funds to enhance that continuum of care for parents and caregivers, maybe exiting that immediate support and treatment that they can provide at their treatment facility into longer term sustainability in our community to help them be successful in their recovery. Secondly, there was another RFP that was released and an agency selected for sobering and triage services, and that was Spokane Treatment and Recovery Services here in Spokane County, and we've been working with them, currently in the process of contracting to get those services and contracts in place to establish more immediate care for individuals in our community needing that immediate relief of sobering services and triage into the next continuum of care for them. And one of the last projects that I'll speak on here is the Spokane Crisis Relief and Sobering Center. And so this is a longer term investment, but as Justin's spoken on before, we plan to enhance our Spokane Regional Stabilization Center by adding a new facility, a crisis relief, 23-hour crisis relief and sobering center to better assist with those immediate needs in our community that don't require that medical necessity component to access. And Justin, I don't know if there's anything more specific that you want to provide an update on where we are with that process.
Yeah, Spokane County has taken on this endeavor, which will require purchasing and building on land adjacent to the current stabilization center. The goal for this is to build out a comprehensive level of care. For everyone who's familiar with relief centers, they allow for immediate 23-hour, 59-minute walk-in and or drop-off for the community, whereas the current stabilization center provides stabilization, withdrawal management, and co-occurring residential. It does require that individuals meet a certain level of care and that they have medical necessity criteria that are met. So as part of this, we are working with the community is saying we need something more immediate for individuals to walk in and receive that care, and it would be available for the 6-county region. Now, it's a bit harder for individuals to come in to Spokane, so transportation remains a challenge, but it is something that we're working on. And I believe we had a question from Commissioner Rosenkrantz regarding insurance. Are we working currently with insurance providers to ensure?
I think working with Maddie's Place on liability insurance issues.
Okay, so I'll touch on that. To the question of insurance with the relief center, we are working with our state partners as they begin aligning with rates associated with what that would look like with crisis relief, and we're working with our managed care organization partners once we look at the long-term selected partner who will be running the facility. So that's all on the horizon, but we have been having this conversation. We looked at more conversation. So for our managed care organization partners, stay tuned. We're going to be talking about what this looks like in terms of county, facility, provider and MCO partnership. But more importantly, we'll be looking at the state for additional partnership as we look to the next to this upcoming leg session. Speaking to the insurance with Maddie's Place, we have been working with them. The ongoing issue with Maddie's Place regards the level of care. And this specifically has to do with housing support as a part of therapeutic engagement. So one of the challenges we found with individuals, specifically moms and babies who are receiving that care and they've gone into that intensive treatment and they're receiving ongoing treatment in the community, that when they're released from that stable housing environment back to the community, oftentimes housing remains an issue, and the housing that is available or they may be in continues to have challenges or other barriers associated to ongoing stable recovery. So this allows for a stable housing situation for land adjacent to Maddie's Place, so they continue to provide long-term housing support in conjunction with therapy. So the insurance would be a part of the transitional housing program and isn't specifically tied to treatment, which is already being provided at Maddie's Place and covered under their insurance. So they're looking at that expansion. I'll defer to Maddie's Place as to what that looks like for this transitional housing portion, but it certainly is less of a hurdle than it would be for the Maddie's Place's direct treatment.
Commissioner Rosencrantz is indicating that he asked because Ponderay County tried to start a similar relationship, but was blocked because of insurance issues.
Yes, I heard about that. I think what we're trying to do here is delegate the responsibility out. So the funding was released to the agency to work that out directly for that capital project. The requirement is for the agency themselves to seek that out. And they're, thankfully, Maddie's Place CEO is also an attorney. So they've been working on this issue for quite a long time. It does not appear to be any issues with that specific to the land that they're purchasing and the transitional housing program they're looking to build. And I also saw the note there, Commissioner Rosencrantz, touching base about the relief center. We would love to talk more about what that partnership could look like and what does that mean for the region. So more to come on that, but yeah, if we can schedule some time, we would love to touch base.
Well, thank you. And I'll turn it over to you for the jail reentry.
Yes. So this has to do with the reentry initiative in partnership with the Healthcare Authority. We've been working very closely with the Healthcare Authority with this 1115 as part of the 1115 waiver reentry work. And Spokane County was selected as part of the cohort 1. And so we've been working with both our Geiger jail and juvenile facility to be a part of that cohort 1 implementation. So we look towards allowing the service to be provided within the jail-based setting. And for those that are being released in the community, that's something that Jason McGill has spoken on at this group before. And we are hard at work to implement that. Looks like HCA just bumped back the date because of challenges that other facilities across the state have been experiencing about this, getting this program up and running. Very appreciative that Healthcare Authority gave it additional time. That has been a challenge to get that second milestone in place with a lot of unknowns. So we look forward to getting that cohort 1 implementation milestone 2 submitted to the state by the January 1 deadline, or hopefully sooner, but I believe that's kind of the timeline we're looking at. And that would encompass, again, all 3 of our facilities here within Spokane County, really trying to enhance reentry work and the transitional support that individuals need as they come back into the community. And that work, we'll be talking with our MCO partners as well, because a lot of that 1115 work as individuals are transitioning can be done through the provider in the community under the contracts that they have with enrolled members. So we will be bringing that up to our JTAC, our jail transition committee that we have established here in our region to kind of look at how can we best align both with the jail and with providers and MCOs to ensure that there's a comprehensive transitional care. And I know that a lot of work with our MCOs have already gone into this. So we very much welcome that conversation moving forward. And we hope to tie that into some of the work being done at our diversion centers, both with our triage and sobering facility, as well as our crisis relief center and stabilization center. If we can tie all of those in there, we hope to build out the diversionary work so that there are less individuals in a jail-based setting that don't need to be there, and that we reduce unnecessary hospitalization or utilization in a hospital for those that don't need to be in there. As part of that, we're also working on co-response still. I know we teased that a little while back. We are still working on it. Of course, there's a lot of hurdles to make system-wide changes, but we're also looking to tie that in. Again, really building on a comprehensive array of engagement services in the community so that we are as preventative as possible upstream, and then we reduce unnecessary jail and crisis system utilization. Back to you, Ashley.
Thank you, Justin. Some other updates related to our BHASO that I wanted to touch on. One specifically being, and I appreciate you being here, Jen, and speaking on 988, because that is one that we have been working on and continue to work on. We did see that policy statement come through within this last week, and we are working and have been working on how we will integrate our RCL with our 988, with having 988 be that entry point into that system, but ensuring that that doesn't affect our regional partners and how they might access that service regionally through the regional crisis line. We do anticipate continued work on this, and especially appreciate working with our state partners to see what that will look like moving forward. And we should have more of an update here in the future on how that transition is going. Other areas of focus, we have been working on preventative care, looking at things such as mobile recovery cafes. So one of those was initiated up in the Pend Oreille area, being able to have some flexibility there to be responsive to the unique needs of a rural community, and ensuring that they can get that connection in different various mechanisms to the community. And that's through community-minded enterprises, CME, better known. Another area of preventative care that we've been working on is just establishing supports with our RMP providers, especially in recent light of the Grant Pass versus Johnson Supreme Court ruling, and how that ruling could have potential to have impact on individuals with behavioral health challenges that are experiencing homelessness and their interactions with the criminal legal system. And so trying to be attentive and responsive to those needs. And as well as Taku, I appreciate you being here and speaking as well on the children's and youth multi-system and care coordination, as that's been a big topic in our region with the recent closure of the Psychiatric Center for Children and Adolescents, PCCA. We continue our efforts with our Youth Behavioral Health Navigator program. They've been doing a lot of work within our community. Our next Spokane Regional Crisis Collaborative, which is coming up on the 26th of the month, will have a youth-based focus with topics such as our CLIP administrator presenting, local agency presenting on the mobile response and stabilization services for youth in Spokane County, as well as Team Child coming to present and speak on what they can provide for our community as well. Justin, I don't know if there's anything I missed there that you wanted to add on.
No, only one kind of initiating. There are expected to be changes to crisis system services as we look towards 2025, and that will be a change that we look across our entire region, 6 county region, which is good changes, good and expanded services, but that does, it's the give and take. When we look to expand services, we have to ensure that there's sufficient staffing, support, and funding to meet the needs in those communities without overwhelming the existing services. So we'll be having conversations with each of the regions and their crisis providers to look at how can we best implement the expanded services. At the same time, having that conversation with our managed care organization partners as we look towards how does that implementation process look like as we look towards 2025. So just more to come on that. Again, no changes at this time that we expect, just going to be shifting and changing and having more of a deeper conversation on that.
Yeah, thank you, Justin. On that, a lot more work to be had on the crisis side with implementation of some regional dispatch protocols that I'll be working with our crisis providers in our counties and within our region on developing those within this fall time period, as well as kind of preparing for other changes associated with 1134 when it comes to endorse mobile rapid response crisis teams and community-based crisis teams as well. Any questions comments or additions to those topics? Not seeing or hearing any.
All right. Like I said, we try to keep the communication out and ongoing. We'll be updating our systems as we know. Again, our primary goal for this is to ensure that when and if services are implemented or changes are made, we will notify in advance. And again, looking to provide the best care and service that meets the needs of everyone throughout our 6-county region. So more to come on that. Just wanted to give a little teaser as to what we look like near the future. All right, that concludes our updates and our set agenda. We want to open it up for any last comments from any of our stakeholders or participants today. If there's anything else anyone would like to add or ask? To share? Or to express joy that it's Friday? That last sun in before it goes away?
Seeing some celebrations.
Exactly. Well, then without further ado, we will end our meeting. It's always nice when we get to have the rest of our Friday. Please have a wonderful weekend, and we thank you all for joining us today. We look forward to our meeting in December. Please take care.
Thank you.
Thank you.
Thank you.
Thank you. Have a great weekend.
Thank you so much.